they relied on the 2011 census, and as you know, things have changed a bit since then. So that would have to be updated in the report. We did review what goes on elsewhere in this country and else abroad for that matter. Some cities are really taking a proactive view, Manchester being one, and I think we can learn from what goes on elsewhere, although we're proud of what happens in Portsmouth. And then we came up with an action plan, some of the issues that Steve has raised. I think there are two. I've got the sort of priority list that our members came up with, and I have to say that social care comes pretty highly up on the agenda, and adequate funding for it, which we're pleased to support in your recent budget proposal, Chair. No one likes to pay any more than they have to, but I think our members, and I'm sure many people in the city, believe that social care has to be properly funded. Scams come up quite regularly. I know the university does a lot of work on that, which we collaborate with. Dignity in dying, issue of contemporary. Hospitals, restrictions, buses always come up in our meetings. When I say I think the bus system in Portsmouth is quite good, they shout me down. They give me stick. They don't believe it, but that's there. And I think the other thing I'd just finish with is not so much health and social care, but the living environment. The areas, and there are some older people's residences, are next to highly polluted roads in this city, bottom of Elder Avenue being one. But the living environment, the everyday, the shopping centres, people are not very happy with what's happening in our shopping centres, according to our members. They might get run down by a e-bike or a cycle. They don't like what they see about the changes taking place in our retail. Well, that's something the council can or may not be able to do much about. But I'm trying to give you the flavour of some of the responses we have had. But I pay credit to Steve. Keeping our organisation going is pretty difficult. You know, we do struggle, so we do rely on you, Chair, and your councillors and officers to take this project forward, and very pleased that Andy could meet us the other day to brief us. Thank you very much. Thank you.
Thank you both very much. If you could retire back to the public gallery, that'd be great. Really appreciate the time you've taken to come and speak to us today. So, on that note, over to Andy to present the report on Age-Friendly City.
Thank you, Chair. So the purpose of the report is to demonstrate how Portsmouth is working and how Portsmouth will work as an age-friendly city. As we've highlighted, the recommendations really are around noting rather than actions at this moment in time, but it's noting how different agencies are working together, and the two appendices that are attached to the report give an example of some of the activities that are taking place in Portsmouth that subscribe broadly to the age-friendly city principles. But also for the board to continue through its members to support the gap analysis that Steve and Alan were talking about, because we'd like to do one within, continue to do one within organisations, as well as draw on the expertise of Portsmouth pensioners to do so. There's quite a lot of background in the report, the original council motion that moved us on this path, and the link from the Age-Friendly City Initiative principles to the health and wellbeing strategy, thinking about the causes and things that we focused on, and also the partnerships that already exist in the city, all of which led to the audit that we did that are in the appendices. And thank you all very much for contributing to that. So the outcome of the audit activity, section 4, there's some detail around those appendices. It highlights some of the further work we want to do with residents with lived experience, and Portsmouth pensioners are a big part of that. To understand where we might be able to make improvements for those living in our city. We know that cash is tight, that it can be very difficult to make change, but there are things that we can probably all do across Portsmouth that don't necessarily cost a huge amount of cash, but could help us improve people's lives in the city. I was going to say we've met with some representatives of the Portsmouth Pensions Association, but then they've told you we've met with some representatives of PPA, and we're very grateful for that support, and we'll look into those areas on the deputation. Thank you, Alan and Steve, and see what we can do about that. So that's a broad summary of the report, but happy as always to take any questions.
Thank you, Andy. Any comments or questions? Graham.
Yeah, just briefly. Yeah, I'm very pleased to see PPA here doing adaptation. I mean, this came up actually at a meeting. I don't know if members are aware. PPA organised a question and answer session for members, and a couple of us, Councillor Pitt and myself, attended. And one of the theme of it was actually the age-friendly city, and it became clear, I think, that there's been a bit of a mismatch between the ageing population strategy, which sort of was prepared and then seemed to disappear. You know, the actions from that seemed not to be followed through, and there was a follow-up supposed to happen. But I can understand the context in which it happened, but it seemed to be there was a bit of a mismatch. And then when, as Alan said, that they produced a document about the age-friendly city and asked for the council's support, again, it sort of went into a bit of a hiatus and not a lot had happened. And it seemed to be the case that when I think it was September last year, there was a meeting where the board presented something, I don't think they were aware of it, and I think that was a bit of a mismatch in communication. So I think it's good to have that back, and I think we've been able to refresh some of the research around what is currently going on. And I suppose one of the other things that struck me about the report was how we get an awareness among older people about what is actually going on, because I think that is part of the problem. I don't think we all know that. I mean, I suppose I might call myself an older person. I'm a pensioner stage, but I didn't know about some of the things that are going on there. So I think we need to think about how we publicise what we actually do, so that as many organisations and groups that work with older people know about this, so they can cascade it through. But I think, as Alan has said, there is probably some more work we could do to improve that. So yeah, I think it's got things back on track, which looks good.
Thank you, Susie.
Thank you, Chair. A few unconnected points, and they're not questions, so you'll be pleased to know that, Andy. First of all, thanks to Steve and Alan for their presentation. I can't give the detail, but I can give some information about the BSIP, the Bus Service Improvement Plan, because I know there's been a survey out recently around bus shelters, and I do know that following that there will be improvements to bus shelters. So that is imminent, and I can find out more detail on that and get back to you. And on staying on buses with the bus pass, I think that is something also that we can refer back to the BSIP team, because I think that seems eminently sensible. If we can start it early, I'm sure we can look at tweaking the end times, especially as it's not going to be a massive amount of people using it. So that's buses. Second thing, around the gap analysis, one of the things I thought when I read through this was, and it's just again to kind of emphasise that connection, and maybe it's a little bit for the Hive, is some of the intergenerational work that's being done across the city. And that's not just organisations like Community Kettle, who that's their USP, as it were, but it's also some of the stuff that goes on informally, like schools going to care homes and, you know, doing carols and all sorts of things. And actually, it's about capturing that. I actually thought, when I saw the Appendix B, I actually thought there was so much going on. And it was back to that point about how is that communicated. It's always the way, isn't it? People need to know what they need to know, and they don't know what they don't know. But I actually think this whole thing about the age-friendly city, that actually rather than seeing it as a project, that we actually just see it as our business as usual and in rolling it out. I think that was my main... the final thing I said, and there's a little bit of personal experience here. It's around supporting families who are supporting older people as well. And again, sometimes it's communication, but it's about where you go. So if you find yourself in a significant caring role, that actually there is the carer centre and they are brilliant, but it's around, are you surrounded around by information that is going to help you keep the independence of people that you are caring for? So 4 totally unrelated points, but thank you, Chair.
Thank you very much. Steve.
I'm going to talk a little bit on sort of on behalf of Lorna and Gemma here, with your permission, do jump in and disagree with me. I think we are seeing as a city a real shortage around experienced volunteers coming forward to take their places as trustees on boards in a range of different organisations, and I think we could be doing more to promote those vacancies that do exist, because you're absolutely right that experience shouldn't be wasted. I'm on a number of trusts myself, and we do struggle for recruiting trustees, but I also know the huge benefit of volunteering. For example, the Boathouse 4 project and the community volunteers that we engaged with at Portsmouth Historic Dockyard, where I'm a member of the Property Trust Board. We've got nearly 100 volunteers working down there now, and many of them are of retirement age or older. And that we do an audit each year on the benefits that they get out of volunteering, and we obviously know the benefits we get as an organisation. They're massive, but the health and well-being benefits for the volunteers themselves is huge. So I think making sure that we're signposting people to where those opportunities are, and particularly around trusteeships, where we have gaps all over the place and we're struggling, we should be making sure that we're connecting to you much better around that. They're both nodding, so they're not shouting at me, so that's good. The other thing, I've picked up the points on flagship, and I'll pass those back to the team. I think they're all really good points, and making sure that we're connecting those things through and taking that opportunity is a good one. And the only other points I was going to make have already been covered by Councillor Horton, so thank you very much.
Thank you, Steve. So, Helen.
Just wanted to add, it's not in the appendix because I think the timing was out, but to promote that we've also been working across Hampshire and Isle of Wight on the integrated care partnership, which of course Councillor Winnington and Andy are both members, and one of the priorities which comes is social connectedness. I probably would have called it loneliness, or tackling loneliness, but hey ho. But there is now a programme being developed, and we had a really well attended assembly. So the Integrated Care Partnership has, I think it's, I'm going to say, is it quarterly board meetings, and then, or is it 2 or 3 assemblies a year?
It's I think we have, every 2 months we have either an assembly or a joint committee. That's how it works.
And Andy, myself, Councillor Winnington, I'm trying to think if anyone else around the table was there last week. It was well attended by over 100 people. I know it was the whole of Hampshire, Isle of Wight, Southampton and Portsmouth, but hopefully we've, as part of the steering group, which Lorna's on, and we've had really, really good attendance at the working group. There is now a framework. I mean, it feels a little bit like it's not starting from scratch. What we're trying to do, because obviously there's a huge amount, and we've just shown, and I think the examples, huge amount of work going on all over Hampshire and Isle of Wight, and definitely in Portsmouth. But I think it goes back to the point that you both made, which is, and Steve then also said, which is then how do we promote? So what we're trying to do, because this is all about ensuring that people have got opportunities to connect, and obviously volunteering being one of the most important opportunities for that happening. So what we're going to try and do is see how we can continue to work together, and perhaps we could contact you to think about how we can encourage, support volunteering, because that was very much a theme of the day, but also some really lovely examples of choirs, bands. It wasn't all musical, but there were some really good examples working with younger people with mental health, but also the choirs were actually supporting people who might see themselves as older adults. So in terms of actually just that connecting point, and particularly around dementia, there was a really good example. And I know we've got choirs in the city, but this was an Isle of Wight example of dementia choirs, where actually it's such an opportunity, because people often can't remember yesterday. I've count myself sometimes in that, but actually will remember from longer, you know, if they're those memories, and music being an important one. So I just wanted to say, because it was a really lovely day, and hopefully we will continue to work across the voluntary sector, councils and the NHS to promote that social connectedness. So we'll be watch this space, and I think using opportunities to actually advertise, but also to market how we're going to do that would be really helpful.
Thank you very much. I'm going to move on because obviously we've got to get through the agenda. But I'll just make a couple of comments. Just on the volunteering, I was having a chat with Lorna a few weeks ago about exactly this, about how do we better interact with people who want to volunteer, and we know that we have a lot of older people who have huge amounts of experience, huge amounts to give, and actually in many ways, and Steve has mentioned about trusteeships, but actually there's a lot of people who would just want to do any volunteering about anything really. And there's some, they are a huge resource, and we know from during the pandemic the amount of people who came out and supported from across the city, and we know in this city people really do make that difference. On the flagship issue, I think that's a great idea, and also I was thinking about some of the other organisations I've been involved with over the years, both in this role and in work roles as well, which I think would be it's a really good idea actually, because it's just a list of something that's going on and making people aware that they exist. So that's a really positive thing, and just like to thank again Pompey Pensions for coming to speak to us, and obviously I think this is a really good report. It's good to know where we are. It's good to know what's already out there. Communication is always, as has been mentioned, always quite tricky. But I think this is a really good way for us to do. And obviously, as with the reports mentioned in 4.2, this will now we've done this audit and then working with reports for pensioners and others, will then be bringing back another a further report will come back to us to make recommendations in further work. So, is everyone happy with the recommendations that we have? Note the outcomes, the activity reports, and support ongoing work as set out at paragraph 4.2 to establish gaps in provision and formulate recommendations to address these. Everyone happy with that? Excellent. So, next is item 6, Portsmouth Safeguarding Children's Partnership Annual Report, and Sarah and Scott, over to you.
Okay. Good morning, everybody. Thank you for the invite to present the Safeguarding Children's Partnership Report. This is for 22 to 23. Just a reminder for members, the LSCP is a statutory requirement upon the local authority, and this forms part of the requirements under Working Together to Safeguard Children 2018. So what has changed is a new iteration of Safeguarding Children, Working Together to Safeguard Children, which was published in December, so we're working our way through that just now as a partnership. But what has remained constant is the 3 statutory safeguarding partners being the local authority, police, and now the ICB, and their function is to coordinate the safeguarding services, act as strategic leadership group in supporting and engaging others, and implement local and national learning, including serious child safeguarding incidents. So I took over as a chair, independent chair and scrutineer. The scrutineer part was a new role that came in when I took over in January, but it gave me the opportunity to review the governance, functionality and impact of the multi-agency safeguarding arrangements, but also seek assurance around the effectiveness of those local arrangements to improve outcomes for children, their families and our community. My finding is that Portsmouth has a mature safeguarding partnership, a partnership that has good strategic level attendance and drive, as well as subgroups that are functioning well to take forward the priorities of the partnership. That partnership membership has also been more tested more recently as well, with Children's Social Care Ofsted inspection coming through favourably. It's also a partnership that embeds well with other partnerships in the city. So I recently presented the strategy to the Portsmouth Education Partnership, but also links across to our local authorities in Hampshire, Isle of Wight and Southampton, which is sort of covered off on page 10, or I think it's page 50 of the bundle. I'll pick out a few highlights from the report. To start off with, going back to 22 into 23, could not mention the pressures on the system, and what I refer to as the safeguarding system, and that's the pandemic legacy, cost of living, budget pressures, workforce recruitment and retention, and increased demand but with an increased complexity of need in a lot of our children, and of course organisational change across policing and ICB as it was. And we still see some of that ongoing in health in particular. Despite this, I see dedicated senior leaders setting the tone for delivery of the best service to children and families. And our priorities reflect the issues facing children and their families in the city just now, and they were early identification and support, neglect, family safeguarding and safeguarding education with a focus on adolescence and impact of our collective activity. So a couple of the key achievements which are shown on page 5 to 9 of the report, or 45 to 49 in the bundle. Family support plan was introduced as part of a redesign of the early help assessment process. This was launched in January last year. It's supporting families with services to provide targeted help and support. Guidance was produced for families and tools, as well as training for staff to use to focus on relational and restorative practice. You'll see some of the feedback on the report, and a quality assurance framework has been developed to monitor its effectiveness, and we actually had a presentation at the partnership last week around how that's progressing. I've observed the growth of the response collectively to both missing and exploitation, which is obviously captures some of the children who are at most risk and also have the highest needs. And the Head of Service has worked tirelessly to develop a pathway, but also some operational connectivity to our collective focus on the children who are at most risk are discussed at a multi-agency forum. Safeguarding and education is a key area for our partnership, but many others across the city. The partnership has a training team who engage across schools in the city to grow the safeguarding culture in our schools. They can provide bespoke support and training for schools who need this. Education link coordinators have also been introduced to provide the connection to Children, Families and Education Directorate, which leads to the identification of the most vulnerable children, and the role in providing regular guidance and support to schools and families of often using the family support plan. The context of poverty is shown again on page 53 of your bundle, where free school meal eligibility criteria has seen steady increase in the last 7 years, shown we're higher than the regional and national average, which links my previous comments about deprivation and cost of living in the city. Pages 15 to 29 of the safeguarding report give an overview of the work of the subgroups, particularly around learning from monitoring, evaluation and scrutiny, focus on tracking key data, but also quality assurance themed audits. Both work in tandem, and you will see from the activity the level of scrutiny that is adopted and continues to be. Contact into the MASH, so the Multi-Agency Safeguarding Hub, has increased and continued on an upward trajectory, 43% increase since 2019-2020, so that goes from 12,924 to 15,192 contacts with those referrals relating to over 11,000 individual children. The increase in demand for universal service, so that's that family support plan and early help, indicates there were more families in need of support post-pandemic, and the cost of living crisis could be one of the contributory factors implicating this. There was, however, a reduction in the number of children progressing to Tier 4, which is Children's Social Care Intervention. That's the highest level, as well as a continued reduction in the number of children on child protection plans and those who are deemed as looked after children. Portsmouth has a strong compact audit, which is a form of self-assessment against 12 standards and relates to all services who work with or regularly come into contact with children. That's on page 24 of our report. They are reviewed and action plans produced by organisations themselves. Support is provided, however, where required, and the summary of the learning is shared. And the final one of our statutory duties is captured under our Learning from Children in Practice subgroup. And that's the statutory duty denoted at the top of page 26. This follows a national process set out by the Child Safeguarding Practice Review Panel. 5 cases were considered. 3 made the criteria for what's called a rapid review, which is a review with all statutory partners and other agencies within 15 days, but none of those cases were followed through to a Child Safeguarding Practice Review. However, that fits in with what the national context is around identify learning early and implement the changes that are required. So finally, at the end of the report and in the papers, you'll see the Safeguarding Children's Partnership priorities were refreshed, and a new strategy was developed for 23 to 25, which is in the bundle, but there's 8 priorities that we set, which has been new since the publication of this report, but it's referred to in the report because of it was created in March of last year. So we have got 8 new priorities for the partnership. That's a brief overview, Chair.
Thank you very much. Sarah, did you want to add anything at this time?
I just want to say that the partnership in Portsmouth is a strong one. It's one of established relationships, and those relationships ensure that we are a child-focused city and an agile partnership, I would say, that responds as need arises. I think the introduction of the head of adolescents and young adults has enabled us to really move forward with those pieces of work relating to risk around adolescence, the pieces around exploitation, around missing children. And the partnership in that respect has really grown in terms of our recent links with the British Transport Police and a real culture of seeing the child first. And I think that it's something we can be really proud of in the city. We know that we have complexity. We know that we have increasing demand. But actually we are rising to that and responding to that. And the evidence, I think, in terms of keeping our children safe, which is obviously one of the reasons why the board is there to ensure that we keep that practice there, is evidence through the subgroups and evidence through the work that we do with Scott as a scrutineer around the quality assurance, around the learning from our children's experiences. And we see that in the majority of cases we maintain that. And where we have taken those children through to rapid review, where those sad circumstances around child death, we know that learning is put in place quickly, but actually we haven't taken any children through to an extended panel review. And that's significant in terms of the learning is done quickly and there are not huge gaps that are letting our children and families down in the city.
Thank you. Any comments, questions? Oh, great.
I had 2 questions, actually. One was a rather detailed question. It's on page 6 of the report, page 46 of the bundle. And it's referenced to a workshop that took place about practitioners and their challenges dealing with guidance and a thing called the Neglect Identification and Management Tool. Everyone says it's not very good. I'm just wondering who is promoting it, and is it easy to either not use it or get it changed? And I have a second question.
I'll answer that question. So the neglect tool it's a bit like the family support plan. We introduce quite clunky tools, quite complex tools, and actually knowing how hard pressed our practitioners are, actually what we want to do is support them with tools and resources that enable them to work in a more agile way again. So the review that we've done in terms of the neglect work in the city has been extensive. And one of the tools that we have now introduced is the lived experience of the child and the lived experience of the family. If we do that piece of work, we far quicker understand the impacts of those children living in neglectful circumstances and put far quicker plans in place than spending a lot longer time doing a piece of assessment that will inevitably lead us to the same outcome. So it's also, if we do a piece of work that digs into and assesses the lived experience of the child, actually then talking to the family and the child is far easier because you're explaining back to them what they've said to you. So we've really moved forward in that respect. I think the other piece that the neglect tool and the neglect work identified for us was that real kind of neglect exhaustion in the city. Our practitioners, our workforce go into family homes continually seeing neglect. Actually, it's when neglect turns into that piece where parenting isn't good enough that we absolutely have to be sure that we're gathering the right information and putting in the right interventions. So those tools are helping, and that workshop really helped move forward on that.
Second point, I just think there may be a small error on page 12 of the report, page 52, because it says 69% of Portsmouth pupils are from a white British ethnicity, which is lower than the national average of 62.6. I think it's higher than the national average of 62.6. Sorry.
Thank you. Any other comments, questions? Natalie?
Thank you. I think it's a really thorough report, and it's good to hold up the mirror. That's what the annual report is doing, isn't it? I just had two questions, because obviously this is 23-24. We're now looking into 24-25. But a couple of the trends. So on page 52, I think we know that we have a number of concerns around elective home education individuals. There's statistics there. But the two reasons given around concerns around SEND provision, but also concerns relating to COVID-19. So in the last 2 years, obviously when we come to monitor the next plan, are we seeing a reduction in the number of children being kept at home because of COVID-19? Because that has significantly reduced. They're the two reasons cited.
So what, in terms of the elective home education, what we see is an increase, a small increase in Portsmouth, and you will see the increases in Portsmouth are smaller than the kind of the national picture at this time, and that is around the robust management and the support and the processes we have in place when there is a request for a child to be educated at home. The reasons for that are shifting, but they are still tied in with the reasons that emerged from COVID, and mental health and anxiety are a large percentage of those concerns. Obviously, for those other children around complexity of needs and the ability and the concern of, I guess, parents for the ability of schools to meet their needs in terms of the complexity of need. Again, what we're seeing is a number, and there was some national information out in the past week or so, that the children that are being educated at home actually returning back to schools in a relatively short period of time. So that connection with those families is really critical for us. We have a team within the City Council that work to support and work with those families to ensure that the education that is being provided to those children is meeting their need, but also that connection then enables those children to kind of process through that admission service if families then request them to come back in. But we are seeing a turnaround for children coming back into school as well.
That's good. That's positive. And my second question was on page 62, which is about the obesity deep dive. And I think obviously as a health and wellbeing board, it should be all of our issue that we have a higher percentage of reception children living with obesity. That's what, 4 years old going into reception, 4 and 5 years old. So if you don't catch it that early, and I just wonder whether or not, because I think we've talked in this board previously about, we know we've got one of the lowest levels of GP ratios in the GPs to patient ratios in the country. The same with what's termed to be the dental desert. But we also have more recently found out that we don't have enough health visitors. And that age between 0 and 4 or 5 years old is probably when health visitors are having more interaction with our children. And I just wonder if there's something as a board we need to do to raise the profile of the role of health visitors. Maybe it's a recruitment issue, but actually it's a great job as well. But, you know, they're the ones that have a lot of interaction at those very early stages. I know we have social care workers and other professionals going in, but we know there is the presence of health visitors in the city is not great. And I just wonder if you can take it all the way back to when children are 2, 3 and 4, and then we see them in year 11 kind of audits or the end of year 6 audits where we get that track of childhood obesity, and then we have the later sort of living with ongoing conditions after that. I just think it's about getting in front of things sometimes.
Yeah, just to say, this starts, you know, pre-birth. This is the work that from midwifery, this is the education of parents, and more importantly, this is the support of parents. And for me, it feeds back to the first 1,001 days, that whole piece of work that we're really digging into in the city. Actually, if we look at school readiness, if we look at obesity, if we look at all of those significant issues that then start to feed the child's journey, if we don't support our parents at the earliest opportunity to understand around good diet, around reading, around literacy, around oracy, then we are not going to provide our children with the best opportunities in the city. We see obesity as a rising challenge nationally. Again, it's been in the national media recently. And I know, you know, I've heard this quote recently from another mouth in the room, but that social experiment of lockdown did not work for our children, and actually the rise in obesity in our children in the country has to come from the inactivity of lockdown, of the lack of socialisation, and actually we need to do something pretty drastic to address that. We are seeking to really make our 1001 day response more robust, but also to think about our public health messaging in the city. What do we need to offer to our parents who may need more support? And we will come on to the family hubs conversation, but it's a critical one for us today.
Helen.
To support Sarah, because obviously there is a lot of focus at the moment on the first 1001 days work programme, but actually I'm going to say this is a bigger problem. It is a societal problem. It's a national, international problem, obesity. We have seen worsening rates through of poor diet, but also many things, alcohol at home, diet, lack of physical activity has all got worse, substance misuse since COVID, and I think it is we do need to focus, because if you look at the Marmot life cycle approach, basically what happens pre-birth is more important as you go up in terms of the impacts of the lifestyle behaviours. They get worse and worse because obviously that then impacts on long-term conditions, disability, need for care throughout life. But I do think it is bigger than just obviously looking at just our children, focus on children, which is really important. It's a whole societal. We are now, and there's some, I'm going to be careful saying that there is the CMOs looking at the moment. We do unfortunately live in a world that's very fast now, with expectation of everything being easy, and part of that unfortunately is processed food, takeaways. So even thinking about our role in planning, our role in encouraging, supporting physical activity, it all has an impact. And I think importantly, because it is our role also as anchor institutions, I'm going to say that in terms of the whole population, we're doing a lot of focus within the integrated care partnership as well, focusing on thinking about this. We are the biggest employers in terms of the count, well actually around this table we are the biggest employers, whether it's the NHS, the university, the council, and even, you know, with volunteers as well. I know it doesn't feel like it, but in terms of that whole mindset, and actually we've got to change something. We've got to change that conversation, and it is about marketing, but marketing itself doesn't work only. We've got to change the whole conversation, because that is why, with huge respect, up the road we're seeing such demand in our A&E and our hospitals and our demand for care because of our lifestyle, and that also affects children increasingly at a younger age. So we've got to try and do something quite big, I would say.
Thank you, Helen. I'm going to move on again because, again, I'm conscious of time. And I forgot to ask Terry to introduce himself.
Yeah, forgive me, apologies for being late. I was caught up in another meeting. So Terry Norton, Deputy PCC for Hampshire and Yard White.
Thank you very much, Terry. Very welcome. Okay, so we'll move on to item 7, which is homelessness strategy. James, over to you.
Thank you, Chair, and I'm delighted to introduce Jo Bennett, who is the Assistant Director of Housing Need and Supply, working for Portsmouth City Council. Jo and her team have been working on the homeless strategy, which was launched in January, and today provides an opportunity for Jo to summarise the report for you and invite any questions. So, thank you, Jo.
Thank you. So I'll note what you've said about having read the report, and I would say that this report is predominantly for noting, but it does ask that you also promote the strategy within your partner organisations, and we thank members of the board specifically for the support and engagement during the consultation phase of this strategy. It was very important to have from partners and colleagues and peers, as well as those with lived experience, their understanding and sight of what this service needs to do moving forward. So we ask that you note the strategy, which became live on the 1st of January. We ask that you note also the 5 strategic aims and the emphasis to changing the partnership board to actually encompass not only rough sleeping but also homelessness. And then the point really being around these strategic aims, and the strategic aims of the new strategy being to prevent homelessness, to end rough sleeping, to provide the right accommodation and housing to relieve homelessness, to provide the right support, and I think most importantly to strengthen our collaborative working on this very difficult topic. And what we particularly ask of members is to think about how different partners can be part of that work. Each of those themes has its own working group that sits under the Partnership Board. And I hope that you will note that the strategy is aimed at action. It is a working document that is aimed at bringing partners together to tackle this very impactful and heavily demand-driven service. We have very good engagement on the current Rough Sleeping Board, and what we've done is to split that membership across the new 5 working groups. And some of you around the table, obviously, I recognise the heavy role that you play in the existing membership of that group. And I ask partners to consider where they might wish to be part of this work and to help us move this topic forward.
Thank you very much, Joe. Any comments or questions? Oh, Terry.
Yeah, so just in terms of us, I mean, that link between probably homelessness and criminality and shoplifting is the one area probably in the city which is going up in terms of crime rates. Everything else seems to be coming down. The chief and the force are really invested in shoplifting task force. So I think any meetings that you have, any strategy, if the force, not getting too involved in operational policing, but if the force can be a seat around that table, I think it would be very, very welcome with the current trends.
Okay, Steve.
Thank you, Chair. I note that, Terry. It is important that we focus on the way homeless people are being exploited. That must be the focus of that, because there's not really any evidence that people who are rough sleeping are directly involved in criminality in that way. There is a lot of evidence that people who are placing themselves on the street during the day but are probably accommodated are indulging in those activities, and there is a network behind it of which we're very aware, and I know you are. So I just want to speak up a little bit to make sure that the focus that we're putting is on the health and well-being and supportive nature of the reach out to people who are finding themselves on the street, but also to say that the people who are finding themselves on the street are not the same people that were finding themselves on the street 6 or 7 years ago. It's changing, and it's changing quite fast. Some of the things that have been particularly dramatic were the government change of policy in August last year, where they suddenly reduced the notice period for those being given leave to remain and work from 28 days down to 7. That was catastrophic in terms of what it did to the homelessness pathway, and I want to just put on record the huge amount of work that Joe and the team have done to rectify that and get us back into a better place, because it was a stupid policy and it needed to be reversed, and it has been, so that in itself is welcome. But I'm seeing a huge change in the type of people who are ending up rough sleeping, and we need to be very alive to that. Also, the number of people who are becoming homeless, albeit not rough sleepers, that's increasing through Section 21 notices, which we know the government's saying that they're going to change, and hopefully they will, and I know Michael Gove is committed to that. But it's so important because people, through literally no fault of their own, are being evicted, not because the landlords want the houses back, not because they desperately need to refurbish them and they've got nowhere else to put the tenant in the meantime, because if they did, we'd work with them on that. But that's not what they're doing. They're evicting people. And, you know, one of our own councillors, Councillor Barrett, she won't mind me saying this because she talked about it on social media, which was really helpful. Her rent went from £850 to £1,400 a month in a standard terraced house. And for a family, if you're talking about cost of living crisis, that's the impact. That's the massive impact they're having. So families that can't afford that won't be able to go and find an alternative rented property for a lower value because they don't exist. You only have to look at social media in this city every single day to see that people are pleading, has anybody got a property to rent within this amount? Because that's all they can afford. And greater support for those families is something that needs to happen, but it can't all be dealt with by councils. We need national changes of policy to enable us to be more effective in how we can intervene more definitively at an earlier stage to stop that happening. And I want to give you an example, colleagues, of the type of situation that's occurring. I know of one family who have, in fact I know of two families, who have two children with special educational needs. One of them also has quite severe physical disabilities. The current system means that they get to a cliff edge before we can help, and that's the way the national system works, and it's wrong. We need to be able to change that and intervene at an earlier point, because we do everything we can to support those families at the point the law requires us to. But we need to be able to build in more flex, and that means we need more funding to create that flex. Council shouldn't need to be creative around what they do to support these families. That should be embedded in the structures that exist in this country. Because if we don't, we are not just heading to a cliff edge, we're going over it. And the number of families that we are going to see in crisis through literally no fault of their own, people who have always throughout their lives been able to support themselves in a private rented tenancy without any issues whatsoever, often with both parents working, that's going to become an absolute bomb that's going to go off in our lap. So this has to be a focus and a priority, and it maps across to the social care issues that Sarah's facing, because those children, once their environments are disrupted, they then present with further complications that they wouldn't otherwise have. It means they have to relocate from schools and friendship groups where they feel safe and supported into a new system where they don't. These are massive issues, and they are interconnected, and we as a group of partners around the board need to lean into this and do everything we can, albeit that the system itself is failing.
Well, Steve. Mark.
Yeah, I'm just reflecting how topical all of these conversations are, the child safeguarding and the homelessness one. We are having a second firebreak week up at the hospital this week, in which we have health and social care partner Simon Nightingale is closely involved in the work, and we actually had a presentation on homelessness from Kerry Gilbert, one of our ED sisters who you probably know, who runs she works as part of the MASS team, which was set up last summer, which basically is looking at supporting in a multi-service, multi-professional manner people who are presenting to ED with homelessness. There's still a small but significant tail of people who are stuck in the hospital because they are homeless, and it's just really welcome to hear. I'm hoping that Kerry is linked in with you, Joe, and that we are able to make a contribution to everything that you're doing. The themes that you describe, I mean, I'm not in any way an expert as you are in terms of the social aspects and the financial rules in which we're living in poverty, but the change in our world, the disadvantage that has happened to young people in particular following the pandemic, who've just lost their confidence and their ability to engage in school and normal life in the way that I think we perhaps took a little bit for granted before the pandemic, is having a significant impact on health and social care services, and we see it in our emergency department and our wards on a daily basis, to the point that we've had at times half of the children in our paediatric unit have been predominantly adolescents there with mental health needs, and with no sign of that destabilisation resolving itself yet. So it's a commentary, it's just saying thank you, it's very welcome, it's fantastic to see the work that's being done.
David.
I welcome the strategy too. Thank you very much to James and to Joe. A statement, if I might, to start off with, which is that one of the areas that the report addresses is homelessness amongst ex-offenders. The Portsmouth Safeguarding Adult Board, as you know, on previous occasions we've talked about the deaths of adults in the city, many of whom have been ex-offenders. We're currently working on a very small research project, looking at the barriers to successful homing of people who have been in prisons. We're looking for about £15,000 to carry out this piece of research. We've got a researcher from University of Southampton. if at the end of this month there is any money left in anybody's budgets that they'd like to contribute to this, we are looking for grant funding. But if there's £500 here or there, it would really, really help us, because we think we've got an issue here that we want to take to government about the significant structural barriers that exists for ex-prisoners. And we've seen the benefit, we've seen the outcomes for some of those people in the city who have ended up dead. So I think, I hope that we've got something to work on there. And secondly, I noticed in one of your priorities for 2024, item 9 is about a new safeguarding policy. So would be happy to help with that revision.
Yeah, sorry to come back. Happy to have a conversation about that offline. You know that we have the integrated offender management homes. We do a huge piece of work in terms of that, you know, ex-offender work, including, you know, £10 million worth of commissioning. So please do come into us. Seems like a relatively small amount. I can't make any commitments, but that's something that I think we certainly could work on. Slightly disconnected as well, but we've written to all councils as well, council leaders, to distribute some work around a pot that we have available for ASB as well. And that's, you know, 500k, and we're inviting bids to kind of get that out the door quite quickly for any small projects. Obviously, we don't want to spend a whole lot in one big hit, but that may be something that we can tie in if there's some links there. So more than happy to help and happy to have a conversation offline.
Thank you very much. And thanks for the report. I think it's a real, it's always a very important one, and the point that was made about the people who are coming in as homeless now are not the same as 6 or 7 years ago. That was a time when I was working with, as a sport worker, with people who were homeless. And I know at that time it wasn't the same as were 6 and 7 years before that, and that's the point we have, that for as things in many ways have changed and in some ways deteriorated in terms of things. I mean, you were getting 6, 7 years ago of the fact that people who had never been anywhere near homelessness were becoming homeless, and now you're getting even more people who have never been anywhere near homelessness who are becoming homeless, and obviously we've been talking about the impact on children and on adults as well. And so just to reiterate, I won't go through all of the recommendations in detail, but just a reminder that we are recommending that we note the homelessness strategy, note the 5 strategic aims, note the change in emphasis of the previous partnership boards, and where we can engage as members of the Health and Wellbeing Board with the partnership and working groups, and as Joe really pointed out, promote the strategy and its aims within Health and Wellbeing Board partner organisations. So is everyone happy with those recommendations? Excellent. Thank you very much for everyone's contributions on that. So move to a verbal report now. So back to James for positive relationships, Health Wellbeing Strategy thematic update.
Lovely, thank you, Chair. And I will try and keep this brief. It's a verbal update, and I'll share my notes also for the minutes. So board members will recall in November 2023, the Health and Wellbeing Board ran a development session to develop the discussion on the positive relationship theme of the Health and Wellbeing strategy. The note of that development session, which was really well attended by many around the table and others, has already been shared with the board, so I won't go into the detail of too much detail, but today provides an opportunity to update on 2 pieces of work that will take forward the positive relationship work, namely a systems review of the services provided to street homeless and a positive relationship conference. I'll start with the systems review of street homeless services, very relevant to the previous discussion. So this work was already highlighted as an action arising from the homeless strategy, which has just been presented to you, and forms part of the action plan for the strategy. The scope includes services that are commissioned or provided by the public health team and the housing services in the City Council, and both Helen and I have agreed with our respective cabinet members that our services will participate in the systems review. we asked the City Council's Systems Development Service to scope the work, and Dave Adams, who's one of a small team within the City Council, experts in facilitating the use of the systems thinking method, has spent time with the day service and the outreach teams and has confirmed that the scope of the review works, and there is certainly from his observation room for improvement or scope to improve the current system and the current offer. It is clear, though, and just to reassure board members, that though the scope is initially focused on very specific services, the cohort, those that are accessing those services, will have multiple contact points with the health and wellbeing system, the voluntary and community sector, and will pull in learning from previous work on adults with complex needs, and also the learning from findings of the recent Adult Safeguarding Board's review of adults that have sadly passed whilst being street homeless. The work will also give rise to challenge. It will challenge us as a collective system as to whether or not we are joined up in the way we're providing services to those street homeless, and also whether we've got the right offer in place. What is it that that those individuals sometimes fall between the crack, or we simply don't have the right support or accommodation to support them. So there is also scope for this work to help inform how we build on the development year we are in for the HDRC work as well. So work is underway to prepare for a systems intervention, which includes forming the intervention team and identifying key resources to be involved and exploring opportunities for others to be involved in that team. We feel it's absolutely essential that officers from the Housing Needs Advice Support Service, so Joe's team, the public health teams, adult social care, and Dave Adams himself are clearly involved. But there will be opportunities for others as well in the wider system. At the development session, attendees agreed the need to have a steering group to complement the reporting line of the work to this board and also to the City Council's cabinet structure. So we'll be coming out to you to ask if you would wish to be part of that steering group, and that will require a commitment to be very dynamic, to work alongside the team that are reviewing the system to help them navigate any particular issues they find, but ultimately oversee this piece of work. We're looking to commence the initial phase of the work in April, lasting approximately 4 to 6 weeks. So the commitment at this point is no more than forming a team and giving that team the opportunity to represent services involved directly in day service and outreach for street homeless, to give them the opportunity, the space and time to study the system from the perspective of the users accessing the service, and to present back to the board through the steering group the findings of that initial phase. It might be that when we see the findings, we all agree that we could do things better and differently, in which case we'd have the opportunity to ask the team to go forward and redesign those services. So just to summarise then, the development session created a very clear consensus amongst partners and an appetite, I think, to find a vehicle in this next financial year to continue the work that we've seen here as a board around the needs of adults with complex needs. The rough sleeping day service and outreach service is an area identified in the homelessness strategy, so it's a piece of work we were intending to do, but it's a great opportunity for the board and partners to participate and for us to connect to bits of the system that aren't initially in scope, but certainly could be as the work progresses. We will update the Health and Wellbeing Board regularly as the work develops on what I hope will be a very exciting piece of work and something that will give a real opportunity to make a difference in the next year for this cohort to remain in a position where they're street homeless with services available, but it's all about challenging ourselves as to whether the services can be better, and perhaps more importantly, to come back to the prevention. Is there more we can do to prevent the street homeless occurring in the first place? So that's the update on the systems review at a bit of a canter. I think I'm handing over to Jason to talk about the Positive Relationship Conference.
Yeah, many thanks. So the provisional title for the conference will be the Restorative Relationships in Practice, and we're hoping to be able to attract 200 participants who'll be able to take part in the day. It'll be a joint conference that's been organised by the Relational and Restorative Community of Inquiry, which is a collaboration between the voluntary care sector, Portsmouth City Council, the NHS and the University of Portsmouth. We've had several meetings already, and I think it's been very, very productive. The provisional date is the Monday, the 15th of July, 2024, and we'll put this in the minutes, and there's some marketing. It's just being finalised, ready to come out, and it's being hosted in the Eldon building at the University of Portsmouth, and the event has been funded by the NHS England Workforce Training and Education. So it's good to get the funding from them. The aims of the conference are going to be really to highlight the importance of restorative relations in practice, and also the expertise that does currently exist within the city that can be drawn upon as well. The idea will also be to introduce the principles of this that many people may or may not be aware of, and also to introduce other ideas that they may not be familiar with. Also to showcase some examples and learn about the potential tools that people can tap into as well. So this might be for things like the pro-social model, Schwartz rounds, trauma-informed approaches, etc., all those kind of things. A really important part of the day, of course, will be networking, people being able to hear about things, then talk to people who are delivering those things, and then potentially take things forward after that then can support them in their own practice wherever they might be.
Thank you very much, both. Any comments or questions? No? Thank you very much for that update. That was really, really helpful, and we look forward to the outcomes of the systems thinking work and of course the conference later in July. And I was remiss at the beginning. I was looking out for people for other people to do declaration of interest, and I forgot to do mine, which is for item 8. Item 9, which is my non-prejudicial interest that I work for Home Start Portsmouth, and this is an information report, so there is no pecuniary aspect. But on that, Family Hubs, over to you, Sarah and Amanda.
Okay, so I'll take the report as read, and thank you. And so we have 5 family hubs that are in the city, and we're currently in receipt of grant funding from the Department for Education. And the vision around the family hubs is that they are a place-based way of joining up locally in the planning and delivery of services for families. They champion integration, and the whole vision is around improving accessibility, improving relationships, and building connections between professionals, families, services. So as we've talked about today, there is a focus on the Start for Life element of this grant, and there are 24 minimum expectations that a family hub should deliver on, and the funding is only attached to, I think it's 4 or 5 sort of streams of that. I think it's just fair to say. And the family hubs, the difference between them, in between our historic children's centres that we had, is that our family hubs will continue to support families with children up until the age of 19 years and 25 years if there is SEND for the child. The funding is broken down into perinatal mental health and parent-infant relationships, parenting support, infant feeding, speech and language and home learning environments, and then there is some funding attached for us to publish our Start for Life offer. And again, it's all around those services being more accessible, better connected and relationship centred. So when we were devising our family hub plan, we looked at some data that we had that came through the JSNA. We looked at the outcomes that we wanted to improve, and we talked about some of those in the meeting today. We noticed that there were some key gaps in some of the services that we had. So we had a very strong parenting offer that focused on supporting parents from that sort of 5 to 19 age range, but actually in the 0 to 5 sort of sector that was coming through the family hub, the evidence-based parenting programs that we were able to offer, we had a gap there. And parents have been very clear when we consulted with them previously around how one size sort of didn't fit all. They wanted a whole range of sort of ways that they could access parenting support. So we didn't have a published Start for Life offer before we had the grant funding as well, which is some really a way of us giving key information to families about the services that are there to support them in those first 1,001 days. And it's really key that we have physical documentation as well, hard copy materials, as DFE will call it, available in the family hubs, that everything isn't just online as well. And you have the information there. So that you might notice that there is more work on the perinatal mental health and parent-infant relationships. That's because in the elements of the grant there is a weighting to the grant, and that particular area had the highest weighting, so that was where the most amount of money could be spent. And you'll see there we've talked to some of that conversation we've had today around health visitors. We're looking at those contacts that we have with families and thinking about how we can strengthen some of those. So one of the approaches that we're introducing is things like the newborn behaviour observation, which we'll be able to use during the 6 to 8 week review, which is a mandatory contact we have with families as part of our Healthy Child programme. I won't go into the detail of all of those because I know that you have it in the report. So we had there's some key work that's happening around infant feeding as well, and around the parent in mental health, and that was around our midwifery support workers. So we really wanted to think about how we strengthen that postnatal time on the postnatal ward in our hospitals, but how we strengthen that handover into community as well. So we're using some of that money to fund midwifery support workers who will work on the postnatal ward, but will also come out into the community and be able to support some of that delivery around the antenatal education. Home learning environment as well. Some of that money is around employing a speech and language therapist to think about how we can identify children earlier and how we can put the interventions in. We've also introduced PEEP as an approach that we are going to use in the city, which is an evidence-based approach, which is around making the most of those home learning opportunities. And we've really been able to, one of the things we really thought about was how are we going to sustain this post-funding, because the funding runs out in March 2025. So we're really thinking about our voluntary sector partners as well, and how we can share this training out to sort of really put a bit of a framework around some of the approaches that we're using in the city with our voluntary partners, but also thinking about that sustainability. And just to go back to our health visiting, so we have our health visitor workforce. I've talked about in here around how it can be a challenge for us to recruit to health visitors. And that has been recognised by the National Institute of Health Visiting as well, but around how we as a service are really thinking about our skill mixing as well, and sort of how we can change our approach slightly to the Healthy Child programme. So of course we would love to be able to recruit to a health visitor post every time we have a gap. But actually, we have, when we know we put out for our community nursery nurses, we have a really high level quality of candidate that applies for that type of post, and generally sort of with a training and experience knowledge base all around child development. So for us it's really, there's a challenge there about thinking differently about what we can do with what we have and how we can sort of attract students into Portsmouth as well to come and work with us. And we did take part last year in a national advertising campaign for health visitors that was specific to Portsmouth. We talk about students within our health visiting workforce as well, and I just think it's key to note that when we talk about students, our students are qualified nurses as well, who are then sort of doing that extra additional bit of training around the public health nursing to sort of become a health visitor or a school nurse. So we're really thinking at the moment around sustainability and what this is going to look like post 2025. We've been very mindful of that as we've built the model that we're delivering in our family hubs. As I talked about already, we've shared some of that training as much as we can with our voluntary sector colleagues, and we're commissioning our voluntary sector colleagues to run a lot of these universal sessions for us as well. And that's probably as much as I need to say. Thank you.
Thank you very much. Any comments or questions on that?
Okay, yeah, I'll add just a very quick comment. Just it's really reassuring, really, to hear you talk about extending your work up to the age of 25. Now, I think through the work that we do, certainly with scrutiny of the constabulary, what we see is so often you get policies that are children's or adults, and there's a huge void between that age of 18 and sometimes people waiting for a service, waiting for some support, but they're 18 and a half, 17 and a half, and they've got to wait, and it's a whole new system, and it completely throws them off. So I know that in Force, they're really, really keen to extend their child-centred policing policy all the way up to the safeguarding part of that up to the age of 24, and it's really, really assuring to see other sectors, services doing the same, because I do think there's a gap, and bridging that is really, really important. So I think we're on a similar page in terms of that approach.
Susie.
Thank you. Thanks for the report. Also, thanks to Home Start, who quite frankly pulled off a miracle in terms of the time that between getting the money and actually starting the work out there with families, and it's really noticeable. So that's good. I absolutely echo your thoughts around the short-termism of it and cliff edges. You're in these situations all the time. Do you do it? Of course you do it because you need it. But actually, how do you plan your way out of it? So I just wanted I'm kind of pulling a few things together, really, is about, Sarah alluded to a comment that, well, she didn't name me, but actually my comment was the pandemic is a social experiment that would never have got through an ethics committee. And we are seeing quite phenomenal. I think it's worth stopping and hearing some of the stuff that we've been talking about today. And we know it's nationally, but actually kids going to school without being able to go to the toilet properly, and not preschool, school, and not being able to dress, and parents thinking genuinely in their parenting role that it's the role of the authority to do things which, you know, most of us in this room would be staggered at. So that is, I think there were signs of it over a number of years, but actually it is quite a crisis situation, particularly in the most vulnerable. So with that, and that reality, one of the things that Sarah and I have been talking about is about how do you push out this sense that it's everyone's business in the same way that safeguarding has landed. So we've had a really good safeguarding report, and actually everyone thinks that safeguarding is their business across partners. How do we do that around all of these other emerging issues, around weight, that's a difficult one, around toileting, around this? How do we get that kind of message out there? And in the face of the you know, the reduction in funding, I'm actually optimistic in Portsmouth, and this board has shown time and time again that when we pull together we can do that. But I do think we need to really set an intention that it is everyone's business to be calling these things out in the same way as you would on a safeguarding issue.
Thank you very much. Any other comments or questions? Sarah.
I would just like to say a personal thanks to Amanda and her team. We could have used some of this funding to bring in project management capacity. Actually, what we chose to do was really throw that money into the provision and the front line and the resources. As a result of that, Amanda and the management team and other staff have worked above and beyond to ensure that this has been implemented. And I just want to say thank you, because it has been an impressive project, and it will make difference. And out of it, we will understand what the things are that we really have to fight to keep.
Thank you very much. And I'm not going to make any comment on this report. But thank you very much for it, and thank you for everyone's comments. So on to item 10, another verbal report from University of Portsmouth making contextual offers. Jason.
You can do. Thank you very much. Yeah, so there will be some slides will be shared in the minutes as well, and it's just really an observation from myself first of all that I think there's a real increase in the awareness of the importance of the university as part of its civic agenda. So I think there is a momentum gathering now that I've seen in several different areas moving forward that I'll just talk about in my short presentation. Today was though very much about contextual offers, and it was about, I think Councillor Pitt last time made quite a robust argument for we need to raise aspirations from all levels of society right through, but the university also very much wants to try and encourage people also to move through to university in the city where possible. In a background at the moment of higher education, struggling with its own funding issues, plus also the increasing competitive nature of getting into university, if we could attract more local students to join us, that would help, A, with the university, but also with those of you that are involved in the NHS. At the moment, the worrying, very large decrease in nursing applications this year that they're seeing that will be required to meet the long-term workforce plan is really, really worrying. So from a university perspective, there's a lot of ways we can all work together that will benefit both the local and the national economy more generally. So as a university, we do have a real will to try and raise aspirations both locally, but also to try and remove some of the barriers that people perceive potentially going into higher education. And as a first-generation person going to university myself, I've been there with parents that weren't aware of the opportunities that higher education could provide. So we do have quite a positive approach to this. We are also at the moment, we're really, like I said, passionate about trying to support more of what goes on locally with regards to everything we do. And a big part of that, you'll be aware of the medical school. So we're having a postgrad medical start this year, hoping to start 54 students. There is evidence that some will remain local. I know many of you have been involved in this. And that is a real important aspiration for us to A, have the widening participation element, but also hopefully that in 4 years, some of those people will remain local as well. And that would be true as well for myself in my school, trying to keep the nurses and radiographers trained. Many of them will stay local once they've been here for 3 years. So that's a really important part of what we do. And we are looking at other areas of healthcare as well, where potentially we might be able to have a bigger impact as well. We'll be aware of some of the outreach events we do as well. So we do Stargazing Live, all those kind of things. So the university does try to have some sort of public-facing presence as well. And also, when students have trained with us, if they remain and come back to us, they also get a discount to do their postgraduate courses as well. So we're trying to build that momentum for people to stay with us and do all their qualifications with us. You might say I'm very lazy, but I did my undergraduate, my MSc, and my PhD all at the University of Portsmouth. But I have the complete set. The key thing for us, though, is so with regards to students, yes, we all advertise our tariff. But the important thing for us is we also really want to carefully consider every student's circumstances when they apply to us. And that's what contextual offer making is about. And so depending upon their background, depending upon the area they come from, and particularly people who come from our local region, they are looked at very, very carefully. And then we can make bespoke offers to those students. That's not unfair on the other students. This is just recognising the different background that students have and the challenges they've had to get to the point where they're even considering applying for education. So we really want to, we can only, bizarrely, I can't show you exactly what we do because, of course, we're a business now, so it is actually quite commercially sensitive, the nature of exactly what we do. But we're trying to get the message out there that we do genuinely look at everybody individually. For our creative courses, for example, qualifications matter less. It's more about the portfolio they come with and the potential that they demonstrate moving forwards. For all healthcare courses, you have an interview. And the interview is almost more important than what you will end up with the qualifications at the end. There are minimum requirements for some of the professions, but that interview, demonstrating the right values, the right behaviours, the right enthusiasm for where you're going, are almost more important than anything else. So a really important part for us is getting that message out, A, to those that might be applying to us, but also potentially a bigger challenge is getting out to the families, the parents, those that will inform their decision-making moving forwards. I've included in the set of slides a whole load of information about outreach activities and all the other things we do as well. But I mean, that's really just for note for people of the kind of things that we do as well. So I'll close there and take any questions.
Thank you, Jason. Any comments or questions? Helen.
That was really good, Jason. I wanted to also add and support, because you mentioned the medical school is going to be so important to us in Portsmouth, because obviously we are really struggling. Ratio of, and it's not all, primary care is more than GPs, can I just say that? That's important because I'm looking at Bernie. But GPs, we've got one of the poorest GP ratio per head of population, and we are a very deprived city, but also the Dental Academy is part of the university. We've been working so closely with us as a council and, well, us as Health and Care Portsmouth, I should say, because it's a joint piece of work. And I'm told by the clinical director that 70% of dentistry can be delivered via the wider dental team, which I think it's a bit like we have a problem. Everybody wants to see a dentist and everybody wants to see a GP. We lack the And we don't actually, we have postgraduate dentists trained in the dental academy, but we don't train, what did I just say? We don't train undergraduates. At the moment, possibly in the future that is going to be possible, but a huge amount of work has gone, and the university, just to say, the university also deliver our oral health promotion work within our homeless population, our care homes and our early years schools. So I just wanted to add, because it is an area, so I know, and also you're sat next to Roger, and two of the areas that he will never leave a meeting without mentioning is access to dentists, primary care. So I just want to add, you know, you've been such a strong partner, and you haven't mentioned the HDRC, and Matt's there as well. You are a key partner with us in our health determinants research bid, which will bring £5 million over 5 years into the city. So all these are just really good, I just want to back up what you've said, really good opportunities.
Yes, sorry.
I was just going to say, going back to our conversations earlier about volunteering, that the University of Portsmouth offers some great opportunities for patients to get involved in nursing interviews and also do some work with the radiography and operating department technicians, so all via Healthwatch Portsmouth and the patient groups at GP surgery, so great opportunity there.
Thanks, Roger. James.
As Helen mentioned the HDRC, it kind of brought me to think that potentially then the HDRC could be a vehicle for us to further understand the context for those and the barriers to why people aren't finding the right pathway to university. The HDRC could be an interesting piece of community-based research that can really deep dive into some of those barriers, because clearly you need to understand the context which to make a contextual offer, and that could be a really interesting piece of work.
Thank you, James. I think the I know HERC came to Cabinet yesterday where we could actually talk about it, as opposed to alluding to it in mysterious terms that we had to do to sign it off in the first place. And I think I don't think that can be underestimated, and I think that's the difference that will make to all aspects of what we do, not just at the City Council but across all organisations in the city, whether they be statutory, voluntary community sector or private sector as well, because it will give us ways to understand our city so much more. And as has been said, the university is absolutely at the heart of that and is a key partner along with the Hive as well. So it's a real opportunity there. I'd like to thank Jason for his report, and thank you for the slides, which, as I say, will be attached to the minutes. And it's a really positive way of looking forwards to what we can do to make sure that aspiration in the city is as high as it can be, and also that people who go to university stay in the city as well, which is a really important thing for us in our local economy and our community. So, moving on to item number 11, Combating Drugs Partnership Annual Report. Over to Alan.
Good morning, Alan Noble, excuse me, Public Health Principal, and I lead on Substance Misuse Commissioning. So just to provide an update on the last year of the work of the Combating Drugs Partnership, because it is a subgroup of this board. So the Combating Drugs Partnership's got three key objectives. The first is around disrupting drug supply chains and drug-related crime. The second one is improving the quality and capacity and outcomes of our drug and alcohol prevention and treatment services for adults. And the third one is around reducing the misuse and harm caused to young people by drugs and alcohol. So within the report, I've detailed some of the progress that we've made. We've managed, with additional ring-fence grant funding from the government, to increase our capacity within our drug and alcohol treatment services after many years of disinvestment. We're probably one of the few areas of the public sector that's seeing more money at the moment. Well, I shouldn't need to. It is ring-fenced, I have to say, sorry. Just to reiterate. but it has enabled us to increase our outreach and targeting of hard-to-reach groups such as the homeless, more capacity working with offenders, etc., detailed in the report. And this has borne fruit in that our numbers in treatment have gone up over the last couple of years by around 25%. The partnership working that's fallen within the Combating Drugs Partnership sees us working with a whole wide range of partners, including the Office of the Police and Crime Commissioner, Hampshire Constabulary, our NHS partners, the Probation Service and voluntary sector. There's a list within the report of some of the benefits that this has led to in terms of increased intelligence sharing with the police and sharing from the police back to us to be able to put in place harm reduction work with our drug users when, for example, there's contaminated drugs in the city. So the number of people successfully completing treatment is increasing, and we are starting to see an increased number of young people now accessing our Young People's Service, the Drug and Alcohol Support Service, or DAS, where we've invested in additional staffing and created a base where they can provide drop-in access now, which is really welcome. So I've detailed some of the challenges within the report as well. So although we've seen an increase in alcohol and non-opiate drug users accessing treatment, we've actually seen a reduction in opiate drug users accessing treatment, which is common across the national data. So the government this year are prioritising that as their kind of number one priority to increase the number of opiate users in treatment. In Portsmouth, we've seen an increase in crack users accessing treatment, but it's the opiate users that we have more work to do with. And within the report, I've detailed again some of the steps that we're taking to do that. So, for example, we're going to be funding 2 new drug specialist nurses up at QA to identify the drug users up there and liaise with our community services and make sure those pathways from hospital to community services are improved. We have a really exceptional functioning alcohol specialist nurse team, and it'll be linked to that team. So hopefully it will perform a very similar role to the way that they do. We've also, in common with the national picture, seen an increase in drug-related deaths. Part of this can be explained by changes in drug supply. You may or may not be aware that there's been a real reduction in opium production in Afghanistan, which has led to lower levels of heroin within some of the actual heroin or opium within the heroin samples that we get within the city and nationally. And partly it's being replaced by synthetic opioids, which are far stronger, far more unpredictable and far more dangerous. So again, we've got some very good links with our police colleagues, but we're also looking locally, working with Hampshire and the Isle of Wight and Southampton to introduce rapid drug testing so that if we can get samples that are discovered within our hostels, if there's an overdose, for example, get it to the lab in Somerstown, get it tested and turned around within a day so that we know what we're dealing with. So locally, actually most of our drug-related deaths are to do with long-term health conditions. It's drug and alcohol addiction is not particularly good on the body or mind. And when you add smoking into that as well, what we tend to find is a whole raft of physical and mental health conditions that often are the cause of the death rather than necessarily a drug overdose. But we're trying to deal with and address all of those factors. In terms of some of the work that we're going to prioritise this year also is around women drug users. Women make up around a quarter of the people in drug and alcohol treatment. From our needs assessment, we suspect there's a high level of hidden harm that we're not accessing. And the feedback that we got from the needs assessment, or the learning that we got from the needs assessment, is that we need some women-specific provision that's away from any men accessing the building at that point, for example. But it also needs to be very holistic and multi-agency because women are coming with a different set of traumas and needs that our male service users don't necessarily have. And interestingly, some of the work that's done recently is that there's a very high prevalence of women being victims of domestic abuse within the drug and alcohol treatment system, but there's also a very high prevalence of men being perpetrators of domestic abuse within that system, and we're putting them together often. So we're working with our partners to develop a separate, more holistic offer for women now that we've got the funding to be able to do that. We're putting some additional investment into our staffing, so we're developing a substance misuse specific accredited training program to upskill our staff. And again, the government funding's been able to increase the salary scales for our staff within substance misuse, which have been relatively low compared to the council and compared to similar pay within Hampshire or Southampton, where they've got bigger national providers. A sticky area for us has been around people leaving prison and engaging in treatment locally, and that's a really big area of focus for us. But it's a lot of the issues that Portsmouth has is common to Hampshire, Isle of Wight and Southampton, and we deal with a lot of the same prisons. So we've been working, and it's actually work that has been led by the Police and Crime Commissioner, where we've done some workshops and we've done action planning and having a common action plan to try and tackle this issue and increase the number of people that engage with leaving treatment. So it's a really good piece of work across the patch, working with our Police and Crime Commissioner. So I've detailed within the plan, the report, some of the investment that we're making this coming year, some of which I've touched on already. And I think I'll leave it there. If there are any questions.
Thank you very much, Alan. Any comments or questions? Steve.
Yeah, thanks, Alan. Nationally, there's been some coverage on this recently, and actually dating back nearly 5 years at different times. The incidence of drug use within the LGBTQI plus community is roughly double what it is within the wider population nationally. Is that something we see as an issue in Portsmouth? Does it present as an issue? And if it doesn't, should it be presenting as an issue? And the experience nationally seems to point to the fact that because that drug usage is often linked to wider issues around sexuality itself and mental health issues and confidence and isolation, loneliness and other things, often members of that community don't feel comfortable going to group discussions and other support networks because of those issues which are underpinning the reasons for the drug use in the first place. And what do we do about that here?
Yes, it is an issue, but it's very much a hidden issue that we're not fully cognizant of, because often the drugs that are used are a bit different from, I want to say, the mainstream. Not that heroin and crack is necessarily mainstream. The usual, I guess, in that respect. There can be different stimulants that are used. There's different patterns of use in that quite often it can be linked to around sex as well. So in terms of what we're doing about it, we have used the new funding to employ a dedicated LGBTQ plus outreach worker, and very much the reason we're not going to get them coming into what is essentially perceived as a heroin and crack service with a very typical type of drug user. So we're developing the links with our sexual health services with the university and with other partners where the client group or the cohort will be, so that worker can go and do the outreach. We've had a few stops and starts with it because people have come into post and then moved on quite quickly, but we now do have a stable member of staff, so that's work that's developing.
Thanks. Terry.
Yeah, thank you for your work on that. It's just to say, I know that we work closely through the work that the OPCC does. Drug offensive is across the city are very, very slightly up, but it could be a lot worse. And the force have introduced drug testing on arrests. So, to be very clear about that, that's not some kind of draconian tool that they're using. It's very much about signposting to the correct services and the support where they feel that criminality is involved or linked to drugs in some way. So I think there's a lot of work going on. There's always more to be done. But thank you for your work on that, and I think it's something that certainly has been great.
Thanks very much, everyone, and Alan, thanks for the report. Just a hot off the press update. So we had the meeting of the latest meeting of the Combating Drugs Partnership yesterday, of which I am a part and Helen chairs on behalf of us here. So and it is always very, very interesting stuff that coming out, and it was particularly, I shared with Susie yesterday, some of the stuff to do with children was of great interest yesterday, and indeed some of the improvements that have been going on there in recent months. So that's really positive, and it does bring together a large amount of organisations in a very positive way, and obviously, as has been mentioned, it sits underneath us here at the Health and Wellbeing Board. So as such, we do have to have a recommendation, which is that we note the annual report. Are we happy to note that? Thank you very much, everyone. And then we have item number 12, Air Quality and Active Travel Health and Wellbeing Strategy. Dom, would you like to? Excellent. Very welcome, Trevor.
Thank you. Right, hopefully everyone can hear me. Hello, everybody. For those who don't know me, I know some of you, I'm sure. I'm Trevor Mose. My day job is Head of Sustainability at the Portsmouth Hospitals Trust. I'm here representing Mark Orchard, our CFO, and been working closely with Dom on this subgroup activity. So kind of just run through a bit of a summary of this report. This was obviously one of the 5 priority areas. We set up the group back in the back end of 22 alongside the other subgroups. So just seeking to look at kind of identifying common ground across this agenda, really, to see where we could genuinely add some value to all the activity that we're all doing individually. And we kind of started that work by just a kind of bit of a deep dive into what our own individual organisations' policies and approaches were, to see what that common ground might look like. The backdrop, of course, which is in the paper, is all around the very real exposure from poor air quality and the impact on public health. So that's kind of a long-term insidious thing, and often affects the most vulnerable and probably the people who contribute least to the problem. So we've pulled together the group, which comprises all the partners around the table, but focuses on the major employers, really. So we've got good representation from various departments across the City Council, Navy, University, NHS trusts, fire and rescue, etc., and some of the voluntary sector organisations too, to kind of scratch our heads and think about where we could genuinely add some value. The group focused on 4 main areas of priority, supporting kind of public awareness campaigns about the impacts of air quality on health, and we've supported the campaigns led by the City Council around the anti-idling campaigns, looking at pollution from vehicular traffic, which is the primary cause of air quality problems. And since then, we've done a more recent campaign in the Cosham area, looking at anti-idling around a particular GP practice in Cosham Health Centre, which is the kind of the more granular level, really, of the public awareness campaign. And there are plans and ideas to take that to the next level around seeing whether you take it to a much more harder hitting campaign along the lines of sort of smoking impacts and those kind of things, which are being discussed, and the group feels quite strongly that's probably might be the next step. So there's always this backdrop of air quality is a problem, but actually I think it has a kind of quite a sharp edge that might be more impactful once we're ready to go for that. So that's one of the main priority areas. The other one was around looking at green travel and active travel. So very few of the organisations involved currently have an active or a current green travel plan. So we were kind of looking around organisations who have got that to kind of share best practice across the organisations to see what can be put in place. And we feel that's a fairly key requisite really of activity to tackle air quality by obviously trying to get people out of their cars, to promote alternative transport arrangements, and green travel plans provide a vehicle for articulating what that would look like based on the numbers in your organisation. But I think it's still, we concluded that it's still for each individual organisation to produce their own. They know their numbers, their staff, their travel patterns, all of that kind of stuff. So, and it will be, whilst 90% of it will probably be very similar around promoting buses and trains and all the rest of it, each organisation will have a slightly different focus, whether it be their car parking problem or whatever it might be that starts to motivate people's thinking about changing behaviour. So I think there's still some work, it's fair to say there's probably still some work to do across organisations around that particular thing. But we're really lucky in this region to have the support of the My Journey travel team. So for those who aren't aware of that, it's this National Highways funded scheme to look at reducing single occupancy trips on the strategic road network around the M27. It spun out of the Smart Motorway scheme many years ago, but there's a team of supporters who are working with all organisations across the region, for whom we as partners can access, and they've been, so we now have access to things like regional car share schemes, on the Lift and Go. There's the Breeze travel platform, which allows integrated ticketing for buses and trains, and all the micro-mobility schemes that we now have operating through Beryl and Voy. So there's a really, really great offer for us as individual employees to take advantage of that, and a consistent offer that then is the same for all of us. So the more of us who are in board with car sharing, for example, the more people are likely to find a match and the more successful it's going to be. So one of the things we all need to do as organisations that we're doing through the group is promoting that internally to our own teams, our own organisations, to make sure the take-up is good of these things. The other aspect is some of the kind of more tangible stuff. So Sustrans, for example, been working on the School Streets project. So now those 2 schemes up and running and more planned. There's a really great opportunity to influence behaviour for life around schools, isn't there? And some of the conversations you've been having earlier on other themes are exactly the same. That getting the messages out there at that is a great opportunity that will hopefully stick if we can manage to shift behaviour. So that was the 4th area was around the kind of EV, so the electrical vehicle charging infrastructure, and again discussions about whether we as a collective could identify opportunities to be a bit more strategic around how we do that. I mean, clearly recognising that the City Council has a huge role in terms of that and has managed to leverage in vast amounts of money to improve the charging infrastructure. There are clearly, and you'll be aware of this, I'm sure, but the plans to roll out on-street charging to increase the number of chargers that are available in the community. There's a number of rapid chargers that have been, or ultra-rapid chargers technically, around the city, so that we're kind of ready for as the proportion of electric vehicles changes. But as individual organisations, we're also trying to do our bit so that we're supporting our own fleets. As an example, from the hospital perspective, we've now got 20 chargers across 3 sites. And how are those supporting the rest of the community? What are other organisations doing? There will be other chargers out there. So it's trying to get this balance of home-based charging versus destination charging, and what is the right way of doing it. But where we can do it collectively and open that up, then it'll be more effective in the long run. And then I suppose that's kind of what we've been up to, the kind of what next, where we're going next. 3 or 4 particular areas we're interested in, one of which is we've not really kind of exploited the mutual benefit of the climate change aspects of air quality. We've been very focused on sort of travel and transport, but clearly there's a huge overlap with things like greening, in terms of mitigation of poor air quality, but also if we're able to reduce the number of vehicles and car traffic, then obviously that has a carbon emissions, greenhouse gas emissions benefit as well. And it may be that that's a more productive way of campaigning, that we need to kind of think about how we do that. So that's kind of one of the areas we intend to look at. The second one is around the work trace travel planning, again taking advantage of the My Journey team as much as possible. The third area is one that's of particular interest to obviously us as a health organisation, is around the role of clinical champions around air quality. We've got a lot of very enthusiastic clinicians who are really interested in this, but as yet hasn't really kind of hit the ground in terms of how they're then potentially advising patients around some of their choices, and that's a very interesting area, isn't it, of medical science about moving into functional medicine and behavioural change, and for clinicians that's sometimes not been on their radar. So we're really keen to kind of work on that, so that we are both role modelling it, but also using that opportunity to influence behaviour. So hopefully you'll hear more about that as that develops. And the last thing, which picks up on a conversation that I heard earlier, which is around whether, and this is a complicated problem, it's multifaceted, it runs across all the agencies involved, and none of us have complete control over it, and whether it's worth the kind of systems thinking type approach to it is a kind of question, an open question. Have we missed something? Is there somewhere else we could go? Do we need to kind of take some time out and just look at it in a more systemic way to see whether there's any other things we should or could be doing? So I think that's it. I don't know, Dom, wherever you are, whether there's anything else. Yeah.
Thank you very much, Trevor. Any comments or questions? Yes.
I wanted to ask a question about the developing active travel plans and how far the organisation is doing that. I'm aware of individual initiatives that organisations have around parking and park and ride and so on. But how far do they share their plans more widely? I mean, for example, with the City Council, because I've struggled a little bit to get a sense of what the active travel plans of organisations are. And I've got a follow-up to come later.
Thank you. So that's one of the things that we looked at when Trevor was referring to that evidence review. We asked partner organisations to share their travel plans, which was a bit of a mixed bag, partly because we don't have every organisation represented on the partnership, but also because, as he mentioned, not everybody's completely as advanced as others on that front. So it's a mixed picture.
Yeah, I mean, I understand that, and the purpose of sort of knowing about it is not to embarrass people, but to just get a better picture of what's going on. And I certainly, as the shadow for transport, don't really have a clear picture across the city of what's happening. The other question I was going to ask was, do they actually monitor and report back what the impact has been? Because that, it seems to me, is quite important. Just to give us a tiny anecdote, university changed its parking policy to effectively change who was eligible. The Milldown car park where I sit opposite suddenly emptied about 2/3 to half empty. And I wondered whether that was because people had stopped bringing their cars, whether they just moved their cars somewhere else, and nobody really knew the answer to that question. The car park's now got really full, but I suspect it's because other car parks have been closed. But, we have a question about, we do something, what impact does it have? Do we know if it's achieved what we want, rather than just move something somewhere else? And that's why I think it's important.
Thank you. Yeah, and I think that comes back to individual organisations having that sense of the potential benefits and impact of their own parking strategy and other active travel strategy. I think what we can do as a partnership is promote the opportunities there, as Trevor's well described. Those measurements are something that we'd foster in partnerships, but it would be helpful to gather that information, I think.
Can I just chip in then? So so from the hospital's experience, just as an illustration of what we could do. So we have a travel plan that we published to 2022 as well, and we're now doing sort of annual surveys to try and ascertain the kind of data that suggests whether or not we're getting it right or not, whether it's changing things. So that's the kind of I suppose it's the best practice model. That's what we're trying to achieve across a wider portfolio. But it's quite resource intensive to try and achieve that. But yeah, if we don't keep an eye on the numbers, then we don't know whether we're making the progress we need to. And the other thing is obviously car parking is a great tool for getting people's interest in these things. We have done 2 surveys consecutively. The first one, which was linked to changes to parking permits, got about 2,000 responses. The one that we did subsequently, which didn't mention car parking, only got about 800. So, and not surprisingly, it showed a much higher use of sustainable transport because none of the car drivers had responded to it. So.
Any other comments or questions? Thank you very much, then. Thanks for the report. That's a really useful update, and obviously anything that gives us an update on our aspects of our health and wellbeing strategy is always welcome. Oh, Susie.
Not on this, but just hot off the press. I thought Steve was still here, but Alan's still. The older person's bus pass is available for 2 a.m. for clubbing, anyone who wants to, already. So obviously we need to get that communicated out. And there is currently a live consultation on bus stops at the moment, which is open until the 17th of March at 11:59 p.m.
Thank you very much, Susie. And fits in nicely with active travel. There is just one extra item. I'm going to pass over to Matt very quickly. It's just hopefully just a formality, but something we do need to discuss.
Thank you, Chair. Yeah, just a quick AOB. So Terry mentioned earlier the OPCC's and Social Behaviour Fund. Portsmouth City Council is submitting a bid to that fund, and as the Community Safety Partnership, we need the endorsement of this board for that bid, and the timescales are very tight. We're bidding from within James's area for some additional redeployable cameras to support community-led attempts to tackle neighbourhood and social behaviour. And happy to circulate the draft bid if people want to, but hoping that we can have Chair's permission to sign off the bid on behalf of the Community Safety Partnership. And if I may, preemptively, if David were to put together a bid to the same fund in support of the work that he mentioned earlier, would you as a board be happy for Chair to sign it off on behalf of the CSP?
Is everyone happy with that? Both of those? Terry?
Can I suggest doing it as a joint bid so it doesn't look like it's lots going Portsmouth's way, if that makes sense? Come together, put a joint bid in. I think it's easier to sign it off in one hit.
Thank you, Terry. That sounds good. Okay, everyone happy with that? Fab. Thank you very much, and thank you very much for the attendance today and your contributions.